Good afternoon and welcome. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, and the VA Office of Rural Engagement. My name is True Luster Pauling. I'm a program specialist at CFBNP. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. This presentation will be made available after this webinar. This is a live recording. I would like to thank Mr. Alex Hightower for today's collaboration. We are grateful for your time today. But before we get started, I would like to introduce Mr. Conrad Washington, Director of the VA Center for Faith-Based and Neighborhood Partnerships. Mr. Washington serves as the Director for the Reverend Washington serves as the Director for the VA Center for Faith-Based and Neighborhood Partnerships. He retired from the United States Marine Corps with 20 years of active duty service with a combat tour in 2004 in support of Operation Iraqi Freedom II. Reverend Washington is an ordained non-denominational minister in the Christian faith and actively serving. He received his master's degree of divinity in pastoral studies from Moody Theological Seminary, master's of arts in business management from the University of Redlands, and a bachelor of science degree in education from Southern Illinois University, Carbondale. Mr. Washington?
Thank you, True. I appreciate it. And thank you all for joining us today in this very hot weather around the country. Hope everyone is well. So today we have Mr. Hightower. Thank you, sir, for joining us, taking time from the rural office to share your expertise. We appreciate you and your boss, Clay, giving my regards. I want to just share a few things with the audience today. As we approach September, we're getting ready for Suicide Prevention Month. We ask that you keep those veterans and families and those who are working tirelessly regarding suicide prevention in your prayers. There are a lot of initiatives happening next month. We ask that you research and get involved. We have webinars each month, as we do today, regarding a wide array of veteran-centric topics. But more specifically, we have suicide prevention every single month. So we pray that you're able to join us. With that being said, we thank you and enjoy today's webinar.
Thank you, Mr. Washington. At this time, I would like to introduce our speaker for today, Mr. Alex Hightower. Please read a summary of his bio on the screen. Mr. Hightower is an educator with over 24 years of federal service, to include his service in the Navy. He currently holds the position of National Rural Veteran Liaison for the Office of Rural Engagement. Alex's career includes positions as Employment Coordinator and Veterans Employment Representative. He also serves as a military and education liaison with several colleges and universities. Alex is an adjunct professor at Eastern Kentucky University, where he teaches veteran studies. He holds a bachelor's degree in adult education and a graduate certificate in veteran services from SUNY Empire State College, as well as a bachelor's degree in sociology from Western Washington University. At this time, I give you our speaker for today, Mr. Alex Hightower.
Good afternoon. Thank you, Ms. Pauling. Thank you, Mr. Washington, for that wonderful intro. Hello, everyone. Again, my name is Alex Hightower, military veteran. Toured in the Army and found that professional camping wasn't my cup of tea, so I jumped ship to the Navy and did another career there and did about 19 to 20 years. I've been all over the world, and I find myself coming back to the U.S. thinking I'm going to be in some of the areas that I went to, and found myself right back in the rural environment. I grew up both in the city and in rural environments, so the military kind of created an opportunity for me to see new things. But as I transitioned out of the military, I found myself back in rural Washington State, which was different from where I grew up in North Carolina. And I kind of present that to kind of let you know why the Office of Rural Engagement attracted me and why I'm here. So with that being said, the Office of Rural Engagement is a relatively new office. It's been around a few years. And the goal in the Office of Rural Engagement is actually for you all The goal is to build bridges connecting with federal agencies, state agencies, local and community programs to ensure that our veterans living in rural environments are being cared for the way they should be. Right now, the VA is actually serving well over 18 million veterans per year. And if you look to your left, rural veterans estimated about almost 4.6 now. The slide is a little bit dated from last year, but it still gives you a good gist of how many veterans are in rural America. And so 8% of the veterans are females, 44% of veterans make less than 35% or 35,000 a year. And more importantly, over 54% of our veterans living in rural America is 65 years older. And so as I was thinking or listening to the intro videos and listening to some of the veterans speak, those that may be alone, those that may be elderly, living in rural environments, have challenges that tend to be more of an issue that they need to kind of work through. And so this is one of the reasons why the Office of Rural Engagement came into play. To kind of give you a better snapshot, this is where the
Okay, okay.
somebody's on hot mic. This map represents the United States in its rurality sense. And so if you look at the bright yellow and the dark yellow, those represent the rural areas. And if you look at the United States, the majority of the United States is predominantly rural. So those pockets of dark blue are your heavily populated areas. And most states have at least a pocket of blue. But the bigger thing is that most of the United States is rural and highly rural, which is why the VA has really honed on making sure that our veterans are getting the necessary resources that they deserve, but more importantly, understanding that living in the rural environments presents certain challenges. So from a rural health perspective, because the VA has been operating in the rural reality for quite some time, many of you all may know about the Office of Rural Health. Phenomenal professionals, they've been doing a lot of the work. The VA realized that healthcare is just one aspect of the veterans' needs, but more importantly, there are more than just healthcare challenges. So the Office of Rural Engagement was created to kind of look at all the challenges. If we start off with the healthcare side of the house, providers, more or less the shortage of providers often creates a barrier for veterans living in rural environments because they're just not there are not enough healthcare facilities throughout, preferably VA resources, but even then, just general providers providing medical care. So the VA has started to look at that as it relates to how can we support that. But for you all to understand, to kind of being that I'm an employment specialist by trade, working with employers, trying to bring providers, skilled personnel into a rural area, it tends to be challenging because one, money may be an issue. Two, it may be family dynamics because the provider may be willing to take the job, but the provider's spouse may need work. And if they're unable to find employment, they may be reluctant to take this position. The other aspect is the children and what extracurricular activities the children have. So just finding providers to work in rural settings can be difficult. The other challenges are geographical and distance. So I'm here in Virginia, and so it's a lot of rural areas in Virginia, but particularly by the water, we have a place called Eastern Shore, which is separated from the rest of the state of Virginia by a 23.5-mile bridge that costs about $20 to pass through. So right off the bat, the distance from anywhere on that side to the VA hospital is a 2-hour commute at minimum. And then you're spending $20 on tolls, and then you have to replenish the gas. Those are what we call those transportation and geographical barriers. Unfortunately, the VA doesn't have resources there, but they have resources above in the next state, which causes another challenge because if they go across state lines and use those facilities, for example, that particular clinic is in Maryland. Now, if that clinic can't provide the necessary care that that veteran needs, that veteran has to now drive to Baltimore, which is 4 hours away. But the closest VA hospital is 2 hours away in a different state. So geographic location and distance can really be a challenge. Another challenge that people, especially veterans living in rural areas, is broadband limitations. So I always like to use myself. My mother, who's 78 years old, has been in her home in rural North Carolina for almost 40 years. Last year, she just got internet for the first time. And so it just shows you that the fact that broadband has been around for years, however, having the access to build those infrastructures, having the money to lay out, pull out the cables and lay fiber optics so that these isolated areas within rural America has internet. And if you remember the map, most of America is rural. So these are the other challenges. Other challenges besides that we talked about is housing. Oftentimes there's limited housing in rural areas, lack of education, not that people don't have high schools, but community colleges, universities, and more importantly, those subject matters that pertains to that particular area of rurality. So Washington State, needs may be different from Louisiana. Florida may be different from California. However, having education in those settings can help create opportunities for the next piece, which is employment. A lot of employers like to go where the populace sit. But when it comes to location and opportunity, rural America has really started to catch the employer's eyes. The question is, who is going to work those jobs? And this is where the connection between employers and higher education really comes into play. And then last but not least is the transportation. Going back to the statistics, over 54% of our veterans are over 65. So a large portion of those veterans may no longer be able to drive. And therefore, if transportation becomes an issue because of distance, that becomes a challenge overall. So the VA is recognizing these challenges, both urban and rural, but more importantly, we're really focused in this office as it relates to challenges for rural veterans. My next slide is just kind of give you a understanding of the VA. Most of us are military, so we understand the chain of command. I always like when I'm talking to people kind of to lay the VA out like a state or a country rather. We have 50 states in the United States. Consider the VA 3 states, the VBA, the Veterans Benefits Administration, the VHA, the Veterans Health Administration, and the National Cemetery Administration. Those are your big 3 states, but also we have offices under the secretary. So the Office of Rural Engagement, as well as my counterparts in our Office of Center Faith-Based, as well as the Tribal Relations, as well as IGA, falls under the Office of Public and Intergovernmental Affairs. And so within this office, we have the Office of Rural Engagement, the Center Faith-Based Neighborhood and Partnership, who's been gracious enough to allow me to talk today, our Office of Tribal Relations, Government Relations, and our Office of State, Local, and Government Affairs. Why am I showing this? Because it's a team effort as it relates to making sure our veterans' needs are met. And so the Office of Rural Engagement works closely with each one of our sister offices to ensure that our veterans' needs are being met. If it's religious-based, if it's working with our veterans on tribal lands, if it's working with city, state, and local veteran directors within the state, each one of these offices are uniquely able to assist and help each one of us. And so that's why I want to kind of share that. The other driving force behind the Office of Rural Engagement is the Rural Partners Network. So in March of 2022, the White House Domestic Policy Council launched the Rural Partners Network. And it's basically a conglomerate of federal agencies and rural communities working together to provide and make sure that veterans and people in general living in rural America their needs are being met. And so with that establishment of the Rural Partners Network, the Rural Desk Officer was also established. So in the establishment of Rural Partners Network, one person from each of the agencies, so it's a plethora of agencies as well as community partners that serves as the point person for the Rural Partners Network. My director, David Clay Ward, represents us, and then our office represents the VA as it relates to the Rural Partner Network. A lot of our stakeholders that the Office of Rural Engagement really work with is the Office of Public and Intergovernmental Affairs that I already spoke about. Our partners in the VHA, as far as the rural health, they're pioneers in the rural space as it relates to working with veterans. VBA Outreach, Transition, Economic Development, VH Office of Connected Care, the Veterans Experience Office. That's a entity which the VA has really used to drive a lot of the driving points, even as it relates to gaming. So that side of the VA, if you haven't stopped by, you ought to swing by and look at the Veterans Employment Experience Office. Obviously, the National Cemetery Administration. And the thing I would say about that, because I just filled out my paperwork for my pre-separation. And that's a benefit that many of you all have and we don't really use. At 53, I just thought about it, and something I was talking to a colleague and they told me about it, and I went on and it took me 5 seconds to set up, but it's already set up in the situation that I may die or pass away. My family won't have to worry about that. So anytime I'm talking, I always make sure that the National Cemetery Administration is somewhere that you want to eventually do a drive-by. The Office of Enterprise Integration, the Secretary of Strategic Engagement, the VA's Veteran Service Office Liaison, and the Vet Center. And I just hit on the Vet Center. The Vet Center, there are over 300 vet centers throughout the United States, and they most likely can be found in one of your communities. And the beauty about the Vet Center, they provide counseling both for the service member, the veteran, the family member, but also service members. They provide PTS counseling, they provide mental health counseling, they provide marriage counseling, military sexual assault. But the one interesting piece that's always stood out to me, those vet centers can also assist active duty personnel. Why is that important? Because some of our brothers and sisters that may still be on active duty, if they find themselves in crisis and they're fearful about the chain of command finding out that could possibly affect their careers, they can go to the vet center, and the vet center's information is separate from the VHA as well as DOD. So just something to think about if you find yourself in crisis, or you know a service member who might be in crisis or just need to talk to someone, the vet center is a great resource. So the Office of Rural Engagement has 4 major goals. The first, we serve as the front door for all rural veterans, families, and communities. And so we try to get out as much as possible. But if you all have any questions as it relates to things going on in your side of the world, and it just so happens to be rural, you're more than welcome to reach out to us, because our goal is, if we don't know it, we'll make sure that we connect you to the people who do know it. The other goal is to assess VA policies and implications for rural veterans. So anytime the VA starts looking at creating policy as it relates to veterans living in the rural area, we try to review that to provide the secretary our best advice as it relates, and then go and work with other entities to ensure that, hey, these policies meet the VA standards, but more importantly, that it will be well worth it for the veteran. Goal number 3 is to conduct outreach and engage in rural veterans and their advocates. So one of the things that this office does now, and we're still relatively new, so myself, my counterpart, Michael Billings, and my director, David Clay Ward, I should say, we really have, over the last year, really have ramped up our outreach. So for myself, I just got back from Georgia. Before that, I was up in Portland, Maine. Before that, I was in Dayton, Ohio. Before that, I was in North Carolina. I'm looking at heading out to Puerto Rico next month if that event is still there. And I say all that to say is that the goal is for the VA to start meeting our veterans where they are, and also making sure that resources are there. And so we work very closely with our VBA and VHA counterparts within your state to ensure that our veterans in those areas, their families are being taken care of, and any concerns or problems that we can address it, but more importantly, address it at your level. And so that's one of the big goals that we have. And the last one is to pilot technical assistance for rural communities. So working with state and local community leaders, if they have programs, if they have things that they want to start implementing as it relates to veterans, we also lend our experience and expertise in making sure that how or whatever they're wanting to set up or produce, how does it line up with the VA? How can the VA better assist this entity in making sure our veterans are taken care of? Our next slide, the Rural Partners Network, just to kind of give you a snapshot. These are the different government agencies that supports the RPN. USDA is the lead based off what the president's desire, but every single agency, and we're not talking about the state and local communities, just the federal agencies. Each and every one of these agencies have a goal and aspirations to ensure that our Americans living in rural environments, and again, we're the VA, so we have a lens looking through the veterans perspective, but they all play a part. We all work together to bring in resources, and this creates an opportunity for us to help those individuals living in rural areas. So the RPN network consists of 10 states plus Puerto Rico, and this kind of gives you the map. The first part of this phase of RPN started off with the states in gold, and eventually they moved on, and now we're at 10 states now. And these states were selected because of the uniqueness of the state, some of the challenges that certain individuals in that state really had serious challenges in the VA, and more importantly, the RPN network say, okay, this is the areas that we want to start. Hopefully these states will eventually grow to the point that the whole United States will be part of that. And again, if you think about the original map that I showed you, the majority of the United States is rural. So for more information about the RPN network or RPN Partners, Rural Partners Network or RPN, you can visit rural.gov, and anything as it relates to ruralness, services, news and updates, this is the site to go to. And each state has a rules partner network. They have a state director. They also have a community liaison. So these are some of the individuals that you can identify. You can go into each state and find out who your leaders are. And then so if there's an issue, if there's a concern, if they have any functions going on, this is a great resource to find out. RPN is the driving force of what the VA does as it relates to veterans, as to focus on what the needs of the veterans are. And so this is a great website, a lot of information. Again, the Rural Partners Network, everything is centered around this particular website. So going back to the outreach engagement, that's the reason why we're called the Office of Rural Engagement. The desire for the secretary, the vision for our director, Mr. Ward, is to really get out and connect with our community. Yeah, we're at the VACO level, we're at the national office, but nothing can be done at the office. What's going to happen is boots on the ground. So here we had the opportunity to visit West Virginia in 2003. We had the state director, Mr. Ted Diaz, come through. We were able to see 150 people. We had federal, state, and community leaders as well that came out. Here, we had an event in Wisconsin, and this particular event, the guy in the middle with the suit, that's Secretary McDonough, he came through. The nice young man with the blue blazer, Mr. Clay Ward, our director, he came through, and it created an opportunity that we were able to get the leadership at the USDA, and they had a little town hall meeting. And so the secretary was able also to swing by and check out some of the VA facilities in that area of Wisconsin. again, engagement and outreach is what the Office of Rural Engagement is really trying to do. Here we had an event in Mississippi. Again, the secretary was there. We had the Honorable Benny Thompson, the congressman for Mississippi. Mr. Ward was in attendance. They had a lot of leaders within that Mississippi community. And this particular event, the opportunity presented itself that we actually had a VA claims clinic. So we had 246 veterans that were actually seen, 168 claims were filed. Not always, but typically what we try to do, especially if it's a major event or an area that claims had not, or not claims, but a clinic hasn't been done in that area for quite some time. We will try to make sure that if the local resources in the state are able to do it, we like to try to create an opportunity so those veterans can file a claim and get the benefits that they deserve. So again, this is another part of our outreach. Here, we were in Kentucky. I think actually my colleague just got back from Kentucky, but I think this was from last year. We also did an event in Colorado, which we had the claims clinic. And then we were down in North Carolina last year about this same time. Here, it's a picture of me. I was in North Carolina. So with the Rural Partners Network, the White House Rural Prosperity Interagency Policy Council, which is the one that initiated the Rural Partners Network. This year in 2024, they also initiated the IPC Investing in Rural America Federal Resource. And it's separate from RPN, but they go hand in hand. And typically, if an RPN event is being held, they very well may have a Investing in Rural America resource fair. And these events is where we bring all the resources, all the key stakeholders, all the subject matter experts in the area of that particular agency, and make sure that those individuals have an understanding of what it is to assist people living in rural areas and the challenges that they face. So this was the first one they had. This was held in Tarboro, North Carolina this year. Since then, we've had about 4 or 5. Matter of fact, the event that I was up at earlier this month in Portland, Maine was also an event. So these are some of the events that the Office of Rural Engagement is a part of. And this is a great opportunity for those veterans living in rural areas. If you hear about an RPN event or Investing in Rural America event, I would encourage everyone to try to come out. We typically, with these events, we try to have somebody, not always the Secretary of the VA. Here we had the USDA Secretary, as well as the White House Domestic Policy Advisor. We also had their local congressman for that area. And in that particular situation, the VA had, or the USDA had just announced that over $700 million would be allocated over 45 states to fund over 216 projects. So that was the first of that news being addressed, and they did it at one of these events. So this is why it's so important. Some of the events that we've done thus far was the Tarboro event. We were in New Mexico in March. We were in Arizona in April. We were all up in New York. Well, I was up in New York in April as well. We were in North Carolina again. We had presence in Georgia. My colleague, Mr. Ward, just got back from Wyoming. I think Mr. Washington was there as well. We were up in West Virginia. We was right back up in Wisconsin. Again, I was in Maine. I just got back from Georgia, and my colleague just got back from Kentucky. So as you can see, the goal is for the Office of Rural Engagement, but more importantly, the VA, to be out and about in the community and make sure that the stakeholders that's within your community are there, and so that we can provide resources, they can gain knowledge as it relates to what the VA can do for their constituents and how we can support their future endeavors. Upcoming events, I will be leaving out next week to go to Alaska. It's been a while since we've been up there, so that we have a big claims clinic up in Alaska. So if anybody's up in the Alaska area and you're in Kodiak or you're near Kotzebue, please come out, even if it's just to get some information. This is going to be a great opportunity, and try to make sure that those veterans up there are getting the services that they need as well. If you're in the Nevada area, we'll be out there September 18th. And right now, tentatively, we should be in Puerto Rico between the 23rd and the 27th. Now, there has been rumors that this has got pushed up a week prior. So to learn a little bit more information, you can just scan this QR code. You can visit rural.gov. The QR code will give you access to the rural Office of Rural Engagement newsletter, and typically we try to send out information as we get it, so that any upcoming events that may be coming into your area, you'll be in the know in that regards. So that's pretty much for my presentations today. I hope, thank you for your time, and I will turn it over back to Ms. True.
Thank you so much, Mr. Hightower, for that very informative presentation. Now we're going to turn our focus to addressing any questions in the Q&A box. We ask if you have any questions to please type them in the box now. I'm going to read the questions out loud, and Mr. Hightower will provide a response. If we're not able to get around to all of your questions today, we'll take them down and we'll get back to you very soon. We have your information to get back with you. If you need to reach out to our presenter, his information is on the screen now. VA Office of Rural Engagement. Here's the phone number, the website. Mr. Hightower, his supervisor, David Clay Ward, and Michael Billings, their other co-worker, email addresses and telephone numbers, and a QR code here so that you can contact them in the event you have any additional questions. So let's get around to the question. First question, Mr. Hightower, comes from Darrell Brown. His question is the term rural used in reference to villages? He said he lives in Alaska.
That's a great question. We look at it in a lot of different ways. So that also coincides with our tribal government relations, but that's the reason why we're going it. So a lot of those areas intersect. So being that you're in Alaska, most of Alaska is considered rural. And so we look at those. And so if you're in the village and your village tends to be in a rural environment, we would count that as well. Our goal is that if you feel like there's access or the lack thereof, that's what we want to know. And that's one of the reasons why this claims clinic came around, because access is hard to get. And then obviously the time of the year. And so this claims clinic that we're having over the next couple of, basically about a week or so, covering multiple areas, is to bring as many resources as possible to make sure those individuals get there. And then we'll have our state and local representatives from Alaska there as well. So if the individual is unable to make it there, they will still get resources to take back to their town and village. I hope that answers your question.
Thank you for that question, Mr. Brown. Our next question comes from Kellen. Are we able to request or host events like this where your team or the RPN Rural Partner Network can come in person to share resources and offer hands-on help for our veterans and military families, such as in Mississippi? If so, is there a cost for in-person training and hosting? Would churches need to have nonprofit status?
So actually, we just had an event a couple of months ago down in Mississippi. The place escapes me right now, but one of the best ways to do it is go to the RPN site, which is rural.gov, and connect with your state director. And within your state director, there's a community liaison. Typically, there's really no cost. They would like to have, like, for example, we just left Georgia, and Fort Valley State University was gracious enough to allow us to use their facility. So, the government works on the budget. And so typically there's really no cost for us to come down. I would encourage you to reach out to your state director. I believe it's Dr. Smith, who's the USDA state director, but she also has community liaison. So you could reach out to them and express your desire for RPN to come in. It may not happen like right now, but they'll put you on the calendar far as rotation, and that way you can do it. Now, if there's certain things specifically that you're looking at, the beauty about RPN is that we all work together. So you call the state director and talk with the community liaison, say, hey, I want to do some talking about veterans, or I want to work with some religious institutions, what have you. RPN will then distribute that information to all the stakeholders, all the government agencies that I showed you before. Everyone has a rural desk officer, and we'll get that information and reach out to the individual to inquire what exactly would they would like to do. And then from our perspective, especially from the VA, anytime we tend to go anywhere, at least in my office, we've always tried to do a holistic approach. I just don't want to come to your town and just talk about one thing. I'd rather bring a slew of services. So typically when we have these investing in rural America events, I try not just to come down to the office. I try to make sure that our partners in the VBA and the VHA are present. One, they get exposure, but two, they're the subject matter experts in that area. Being that we're in DC, we don't know the areas like our partners in the state. So we try to collaborate with them. But your first step as it relates to when it comes to the RPN is to visit rural.gov, find your state, and connect with your community liaison.
Thank you.
Thank you for the question.
For that question. Thank you so much. Question 3 comes from Denise Hernandez. Is there any way to assist as a community resource partner at your community events? What's the process to become approved as a volunteer or resource partner organization?
So again, as it relates to the Office of Rural Engagement, we don't really do anything like that. We're in the engagement piece for the VA, but we collaborate, i.e. with the Rural Partners Network. So if there's an event that you're wanting to do as it relates to things in your community, in the rural space, the RPN network specifically is there. But if it's something veteran related, by all means, you can reach out to us. There's not so much a order in that regards. It would just basically, from our perspective, we would assess and see what the what the concerns are. We will also get with our state directors, the director for the veteran services. We also get in touch with our partners in VBA and VHA to identify, hey, this is a need, this is a potential possibility to collaborate, and we will be the talking point. So for example, my office right now, going back to some of the challenges that veterans faces in rural spaces, broadband, having access to the internet, having equipment to use it, and then having broadband, having access to equipment and no knowledge of using it is just as bad. So making sure that the literacy programs are available. So we're working with the Office of Connected Care along with NTIA, which is the National Telecommunication Information Agency. They're the ones that have all this money that's being rolled out to the individual states so that they can start building out more internet infrastructure and more people getting broadband. Again, my mother just got broadband after almost 40 years because of this same program and the money that's being utilized. So we tend to provide insight and we work together in creating these relationships. To your question, Ms. Hernandez, our goal is to ensure that we connect you with the right person from the VA's perspective, but from other different perspectives, the best person that you could talk to Ralph the bat will be your community liaison within your state under the RPN network.
Thank you, Ms. Hernandez, for that question and that response, Mr. Hightower. Our next question comes from Osman Malcolm. Is there any plans to visit rural engagement in the state of Iowa?
That's a good question. A great question. I will definitely bring that up to the bring that up in the next RPN meeting, which just so happens to be tomorrow, and see where it is. I will say this, that our right now is not part of the Rural Partners Network, is not one of the 10 states. However, the director for the Office of Rural Health just so happens to live in Iowa. And so there's opportunities. It may not be with RPN, but that doesn't mean we can't create opportunities or at least have a discussion with our folks on the other side of the Office of Rural Health. But again, I will present that up to the Rural Partner Network meeting tomorrow and see if anything is coming down the pipe. That being said, if it's something veteran related, we can also reach out to our VA partners and VHA partners to see how we can provide some opportunities. Again, the claims clinic just didn't happen overnight. Discussions were made, discussions were had, opportunities to identify times, what areas would the VA want to attend, where it would be the most effective. So a lot of these questions could be asked, but I appreciate that, and I will bring that back up. And please shoot me an email just as a reminder, and I'll follow up with that question tomorrow at the Rural Partners Network meeting. Thank you.
Thank you, Mr. Malcolm, again. We do have another question from Ms. Denise Fernandez. Who would I contact to volunteer a location to host a VA clinic in Brown County, Ohio?
You could, so you want to support the VA and provide space if they wanted to have a claims clinic. Is that what I'm at? That's what I'm hearing? If that's the case, we would most likely, thank you, Denise. If that's the case, we could reach out to the RO director, regional office director within your state and see what we could do in that regards and see if they have anything, because we don't want to reinvent the wheel and we don't want to encroach on what they do as a state as it relates to their claims clinic. A lot of states are actually doing it. North Carolina, that's where I cut my teeth at. They're the one that kind of really started it, and it's kind of morphed into this thing now. And so the VA tries to have sponsored events, and then we work with the state directors to create opportunities. But a lot of places that I've seen throughout are veteran service organizations, VFW, American Legion, DAVs, churches have also been a great spot. So if you have a spot available and it's large enough that it can support the VA and all its staff, that's a good piece of information that the regional office will want to know, and the director specifically. And if you can provide me the information, I can forward that information to your director in your state.
Thank you, Ms. Hernandez. Next question comes from Bill. Are working with VA Health Atlas telehealth program? I think the question he's asking is, are we working with VA Health Atlas telehealth program?
Great question. Absolutely. So the Office of Connected Care is pretty much over the Atlas program. And so the Atlas program allows VA to provide telehealth. And again, that's one of the challenges with living in rural areas. So with that being said, Atlas allows us to use Walmart, civil centers and stuff like that. And essentially what it is, the VA is able to go into a space that is a non-VA space because the lack of transportation, the lack of VA facilities in the area is just, it's a challenge, it's a distance. The VA is slowly working with different entities throughout the United States. I wish I would have had that map. I would have provided that. Thanks, great question. I will make sure we put that slide into the next presentation. But it basically shows different areas throughout the United States that veterans can go to. And so everyone may be able to go online, but sometimes access to internet may not be available. But this is where the Atlas sites come in. It's VA, it's a non-VA location that VA has established with the entity that's there. And they've created a safe space that a veteran can go in and meet with their provider, whether it's medical, mental, you have it, they can go and do it. And that way they don't have to go a long ways. They don't have to worry about transportation. They don't have to spend X amount of dollars to visit that. So yes, this office is closely connected. We just had a meeting today. Again, the money that's being rolled out to expand broadband, the VA's effort is being led through the Atlas and the Office of Connected Care. And that's what we're doing now, is reaching out with all the state directors to ensure that the money that's being allocated to them to really expand their broadband throughout their state. There's 8 stakeholders that this money has to go to, and 2 of them are either veterans or folks living in rural environments. So that your answer is yes, but it's way bigger than that. But it was a great question, and thank you for that. And I'll make sure that get put in our slide in my next presentation. Thank you again.
And our last question comes from Daryl Brown. Have you interacted with TREP programs of the Navajo Nation and Gilder River Indian Community Programs?
I personally haven't, but I'm sure our office has. Mr. David Clay Ward is from the Oklahoma. He's Native American as well. He has worked with several of them. Plus, he was with the Office of Tribal Government Relations. So if you have a specific question, please shoot me an email, but more importantly, shoot Mr. Ward an email, CC me on it about your concerns, and we can definitely get you connected to the right person as it relates to any questions or inquiries that you may have.
So that's the end of our questions for today. Thank you so much, Mr. Hightower, for that excellent presentation. To our audience, if you need to reach out to the presenter, please see his point of contact information on the screen now. You can also reach out to any of his team members on the screen as well. At this time, I'm going to turn the mic over to Mr. Washington, who will provide some closing remarks.
Thank you, True. Thank you, Mr. Hightower. As usual, great information you provided. As a side note to our attendees, I wanted to share that the question regarding the Atlas program, we actually are going to have a webinar on that program on September the 10th. So please subscribe so you can get the webinar information and join us. But again, thank you all for joining us today. We appreciate it. We know that rural veterans are very important to VA, and that's why we have the office. That's why we have experts like Mr. Hightower and others as well. So again, thank you all very much and have a blessed day.
If you registered for this event, we will provide you with today's presentation. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website and Facebook for future webinars and information. This adjourns today's webinar. Thank you for joining us today, and goodbye.